Hi, welcome to the section of cardiology, the study of the heart. This is Dr. Jaitly. I'll be talking to you in this video clip to tell you what is a heart murmur. I'm sure you have heard of doctors, physicians during the time when you are being examined or you've just finished your visit to the doctor's office, etc., that the doctor found or heard a heart murmur. Now, a heart murmur is an extra purring like sound. It's almost like the cat's purring, the humming. The purring sound arising from the heart, okay, as the blood travels through these valves. Remember, there are four valves. As we talked about, the heart has four chambers: right atrium, left atrium, right ventricle, left ventricle. And these are the valves. One is a tricuspid valve, the mitral valve, the aortic valve here, and the pulmonary valve. So these are the four valves within the heart. So as the blood is squeezed from one chamber to the other, normally it passes through the valves, but if the valves are a little more not opening too well, or opening and not closing too well, will cause this purring sound as the blood will pass through these valves, and there would be some turbulence, we call it, or an improper closure or opening the valve, resulting into an extra sound called the heart murmur. Now, sometimes it could be functional. We call it normal, okay? And like in a setting where, say, somebody is anemic, or the hemoglobin or the red cell count is low, then the blood tends to have a less viscosity or the thickness, and as a result, some of that will cause a little extra sound through these valves. But that's normal. Now, when the turbulence is because of, say, the improper closure of the valve, or improper opening of any of these four valves, now that is abnormal. Now, as we all age, the valves will have a wear and tear. Remember, the heart is aging, so it's not the same as it was, like, when it was totally normal to begin with. So over a period of time, there's a normal wear and tear, just like in any other thing, like in your car, in your house, in your bike. So there's a normal wear and tear because these valves are going back and forth constantly with each beat of your heartbeat, if you will. So that wear and tear can sometimes progress. And when it progresses to an abnormal pace, in other words, if this wear and tear is beyond the normal that's expected, that is significant. And that significant heart murmur be assessed with your physician, and the physician can follow up with an echo. Now, that's an ultrasound technique. We'll talk about that in a different video presentation. But an echo is an ultrasound technique which tells us where this heart murmur is originating from, whether it's originating from the tricuspid valve on the right side, the mitral valve on the left side, the aortic valve here, or the pulmonary valve here. So, and also it'll tell us whether it is significant or not significant. Now, many of the athletes will also have valvular heart murmurs, as we say, and mitral valve prolapse syndrome is a very, very common entity. That's the commonest cause of heart murmurs on this planet, if you will, mitral valve syndrome. And then, of course, in the childhood, there is history that the person during the growing years has had rheumatic fever, rheumatic heart disease, which was very prevalent in certain areas in some subcontinents. It's diminishing, obviously, but still very prevalent in certain migrant populations. And then infections and IV drug abuse. Now remember, people who have history of IV drug abuse will invariably use not aseptic precautions, and as a result, infections can go via the veins and then harbinger. The infections will harbinger or sit on these valves, and as a result, these valves will develop some form of regurgitation, we call it, or sometimes even stenosis at a later time. So anyway, what is a heart murmur? Heart murmur is an extra sound which is heard by a stethoscope. The doctor discusses that with you, whether it's normal or abnormal, depending upon what the doctor suspects based on your conditions we talked about, and then orders an echo. And from an echo, one can tell which valve was affected or which valves are affected. It could be multiple valves. And as a result, one can really learn so much from a stethoscope and an echo examination and a physical examination, and of course your history. All right, I hope you found this fascinating, because heart murmur is it's a very common entity and one should be aware of. Okay, talk to you more in my next. See you again. Bye.